I have no conflict of financial interest and conflict with the equipment and the providers, and that's why I can give my best opinions independent on this subject, sharing technological components in innovative telemedicine. I have about 20 slides to give you an overview and a quick overview about the telemedicine in France, and after we discuss about IT platform we have put in place in France and specificity in the Paris region, focusing on the sharing model and the economic model. So many hospitals and health organizations find themselves with different IT solutions for telemedicine, which are actually in silos. One for telestroke, another for telepathology, or for telemental, like autism, and this is cost increase of the telemedicine, in fact. And this presentation shows how we have shared the telemedicine IT platform for several uses and for different health organizations. Just to give you a quick overview about the France is big as Texas, but with a population with 3 times the one in Texas. In France, health and therefore telemedicine are organized at 2 levels. One level at the national level and another at the regional level. At the national level, the telemedicine has been defined as a medical activity with different acts, such as teleconsultation, teleexpertise, teleassistance, and health surveillance, like remote patient monitoring. At regional level, the regional health agency is in charge of planning, authorizing the actors to perform the telemedicine acts and finances, in some cases, the telemedicine activity, like the national level. In some cases, the telemedicine activities is finances. In conclusion, the telemedicine activity is structured and regulated in France, but the financial subject is in work in progress to pay medical acts by telemedicine. Paris region is populated by 12 million people, similar to Pennsylvania state for surface Lake Connecticut. It's the richest region in France, offering a wide type of healthcare, but mainly in the capital in France, in the city of Paris. Therefore, telemedicine has a good reason to be developed in the whole Paris region. And our organization, SESAN, previously called D-SISIF, operates at regional level. It's like similar to telehealth resource center in state in the US. And we take a key role in the development of the telemedicine by managing an IT platform, telemedicine, called ORTIF. The regional group SESAN is a non-profit organization, a pivotal actor in the structuring of health telemedicine system, and a key partners for Health Regional Agency and Health Ministry in Paris region for the AERS. Sorry for the extension. Our organization employs a staff of 70 people, and we have medical doctors, IT engineers, project managers, and 5 people work full-time on telemedicine for conception of and deployments of telemedicine IT platform, assistance, education, and information to health organizations and professionals. Now, focusing on our telemedicine platform, we have 4 operational guidelines. Building a partnership innovation model with the health industry. This is for control the development cost. A partnership based on innovation has been established with manufacturers. Building a SaaS model. SaaS is software as a service with manufacturers. This is for sustainability. The SaaS model was jointly built with manufacturers. Thirdly, respecting both international standards and national regulation, and this is for the securing the platform. And finally, searching a regional and local sponsor in each structure for medical projects, and this is for the involvement of each health organization. Today, you can see in this slide the main results. ORTIF serves several uses. More than 90 health organizations in Paris region use ORTIF today, and the SaaS model and the trust environment have been defined and implemented. Today, after 2 years from its birth, ORTIF is a platform in French which has the strongest growth in number of end users and patients. For example, last month we had more than 1,200 patients in the IT platform. Currently, we have an exponential growth in number of patients. This is a non-exhaustive list of usage specialties, but that gives you an idea of its usage. There are many different health organizations which use IT platform of telemedicine ORTIF: hospitals, primary cares, nursing homes, and jails. Many of them have only recently started to use ORTIF. ORTIF first version has been implemented in October 2014 for uses in telestroke, teleneurosurgery, and teleradiopediatric. In 2015, new features have been added to meet new mental health care like autism, teledermatology, and palliative care, and geriatric psychiatric, and heart failure. Some medical telemedicine are located only in a part of Paris region, another all around the Paris region, and some of them all around the France, like regulation for transplantation and neurosurgery. ORTIF is a full web platform which offers a catalog of services allowing medical data sharing, transfer and consultation of medical images, visual consultation, and use of collaborative function between several sites and players. Through ORTIF, we have successfully implemented and expanded modular functionalities for teleconsultation, teleexpertise, teleradiology, and now remote patient monitoring. Teleradiology started the last months. Other functionalities are equally important, such as access to data, to analyze the activity of telemedicine and to finances this activity, a directory to identify a community of practices, and a directory of pattern detection like medical algorithm for helping diagnosis. All the developments are made by manufacturers. ORTIF platform can be accessed by health organizations outside our Paris region, and this year, more than 50 hospitals outside Paris region will connect with ORTIF platform. ORTIF platform allows to access the post-treatment images operated by SESAN, and also to the post-treatment images services operated by the IT team of health organization, and integrate with the eHealth. In terms of trust, from the very beginning, we adopted a very strict support policy, a 24/7 hotline for the end users, a certification for hosting data in the cloud for the health ministry, and high availability of the platform with a set of service level agreements signed by the manufacturers. Zero data lost, and finally, complete tracking of data with the storage of the technical and functional data. And this is built the trust environment. We work with the selected manufacturers to define and improve our SaaS pricing model on our private cloud platform. First of all, we have started by establishing the main economic principle for the SaaS model. First, we have to research the simplicity. Secondly, we have to research a model for all parties involved in the Telemedicine Act. And finally, we have to find an economic model where each party must have a realistic expectation of its cost, and the cost is related to the usage. Then, we have defined the ways of working. First, the platform economic model has to be a subscription cost model based on selected services and the expected service level. The price metric is based on a mix of packages of functionalities and the level of service to recovery time. Secondly, the health organization needs to sign a contract with SESAN. And thirdly, we wanted to have functionalities to change a user into a contract subscriber. We call it guest mode. It's like a freemium functionalities. Finally, we have adapted the economic model to each segment of health organization. And for example, the price is not the same for an hospital or for a GP. The chart provides the various economic models to help you understand how the different costs built and run are made. The setup and the running costs for each health organization are paid by the health organization itself. The running cost is capped, a fixed price for unlimited users. Telemedicine acts for teleconsultation, tele-expertise, allowing health organization to have a visibility on costs. And then there are some key factors for operational success. To implement the telemedicine platform with a chair model and a SaaS model for several uses and entities. We think there are some key factors for operational success for all parties involved, for end users, for financial departments of each health organization, for manufacturers, and for the IT organization. For end users, we have to find the right balance between the sharing and the customization of the platform. And we have to adapt the platform for the specificity of each medical project. And for financial departments, no cost for the building of the IT platform and an extra transparency on the build and the running cost. For manufacturers, new functionality defined and developed for SESAN are free to market anywhere, and for SESAN doesn't pay for development. SESAN must have to adopt a product approach and not only a project management approach for the conception of the IT platform. Then some benefits of a shared telemedicine platform, focusing on medical projects and not technology, saving time in IT implementation, easiness for users, for financial of health organization, limiting investments and limiting IT resources, cost transparency to the SaaS model, and for all parties involved, for these new functionalities are paid by subvention and for manufacturers, but the running costs for organization are paid by the health organization themselves, and that is the sustainability of the platform. Thank you for your attention.
Well, my job is easy today. So the last presenter comes from Brazil.